I'm glad that you could join me. My name is Jeff Mason. I'm a board-certified clinical hypnotherapist with Abracadabra Hypnotherapy in Boise, Idaho. And welcome to my Abracadabra and Herbology video blog. Anyway, I wanted to just take a few minutes to address an article that I was reading that was brought to my attention on WebMD about smoking cessation. It was written by a medical doctor. And I wanted to point out a few things, a few discrepancies in my opinion that I find to be very biased about the article. Anyway, I'm going to skip, for the most part, I agree with at least about half of what he wrote. But then when he got toward the end of the article, he stated, "Does hypnosis work?" And he wrote, "Hypnosis in general does not work for everyone." Now, I want to stop right there first off and foremost. That is true. And one of the reasons that a hypnotherapist should have a pre-induction interview or give a free consultation is so that they can sit down with a person, find out what their needs are, get a feel for them, and let them get a feel for him or her, and they can assess their ability to respond to the technique before any commitments are made. But even that aside, in fairness, is there any therapy that anybody out there can think of that works for everyone? I can't think of a single one. It doesn't matter whether it's an aspirin or an antibiotic or a physical therapy or what it is. No therapy works 100% of the time and for everyone. It could be a cancer treatment, doesn't matter. Does cancer cure everybody? No, it doesn't. In fact, the vast majority of people, at least under the conventional method of cancer treatment, typically die. But sometimes they don't. Sometimes they are actually, the treatment actually works. But does it work for everyone? No, it doesn't. So to say, to kind of put in brackets, hypnosis in general does not work for everyone, well, that's a true statement, but that's a statement that applies, again, to every type of therapy and every type of treatment that's available, both in alternative natural medicines as well as conventional allopathic approaches to medicine. So going on, about 1 in 4 people are not able to be hypnotized. Well, that's debatable. We're not exactly sure if that's actually the case. It might just be that they wound up with crummy hypnotists. And it may be legitimately true that they can't be hypnotized. But then again, if they've only had an experience with 1 or 2 people, it might be the people and not the fact that they are unresponsive to hypnosis. So that's kind of an iffy. We don't know for sure. When successful, the intensity of hypnosis can vary from person to person. Well, that's true. Hypnosis can vary from person to person. And so therefore there can never be any expressed or implied guarantee of results. But isn't that true with any therapy? I mean, I could take Tylenol for a headache and it works just fine for me. Somebody else can take that same Tylenol and they either get no relief whatsoever, in other words, they're not hypnotizable, or it only works so-so, not as good as it did for me. So it can vary from person to person. All therapies and treatments, however, fall into that category. It's not just hypnosis. So to me, the way it's worded just comes across bias. Okay, how will hypnosis work to help people stop smoking depends on who you ask. Study results have been mixed. In 2010, a systematic review of published studies found that there wasn't enough evidence to support that the use of hypnosis, while another study published in 2012 said that studies do support a possible benefit from the use of hypnosis. In discussing alternative methods for quitting smoking on its website, the American Cancer Society says that while controlled studies have not supported the effectiveness of hypnosis, there is anecdotal evidence that some people have been helped. Well, there have been over 150,000 papers, professional, peer-reviewed scientific papers over the last 75 or 80 years published on hypnosis and experiments with hypnosis throughout the years that are actually in print, that can be found, that demonstrate that hypnosis actually does work. In addition, this idea that when it comes to smoking, that there's no evidence, there's no studies been done. The University of California, I believe it was 2012, I think it was, published the results of their findings. They took two groups of people to compare the different modalities between behavioral therapy and hypnosis, and which got the best results for quitting smoking. And in those results, both groups were on nicotine patches as well. Well, at the end of the study, and then went back 6 months later, they found that 28% of the hypnotized people who also had the nicotine patch were still non-smokers, in comparison to only approximately 19% of the control group that also got the nicotine patch in the behavioral therapy studies. And then they went back a year after that, and they found that with the hypnotized group, there was still 24% of that particular group was still not smoking, while it was only about 14% in the other group. So it demonstrates that hypnosis definitely is better than a placebo, and it's definitely better than many other therapies that are out there. They've also done studies to compare how well hypnosis does versus just the patch, if you just do the hypnosis or just the patch. And they found that hypnosis is about 3 times more effective at getting people to quit smoking than even the nicotine patches. Now, in comparison to its use with Zyban and some other drugs that help to take away craving, they found with smoking cessation, with hypnosis was not quite as effective as the drugs. But they did find that when they combined those drugs with hypnosis treatment as well, there was far less percentage of relapse in the people that were treated with the hypnosis versus the ones that were just taking the drug. So the hypnosis, even in that situation, actually made the drugs more effective, and the drugs made the hypnosis more effective. So it kind of played into one another. But there was far less relapse with the people who had the hypnosis. So there is papers out there. There is scientific evidence out there and scientific studies out there that totally refute what's on the Cancer Society's website. Anyway, moving on, and that was from the University of California School of Medicine. So anyway, moving on. Despite some websites and promotional materials that say otherwise, hypnosis is not an approved therapy by the American Medical Association. The organization does not have an official position on the use of hypnosis. A position statement regarding the use of the technique for medical and psychological purposes was rescinded by the AMA in 1987. Yes, it may have been rescinded because of politics that were being played in the AMA, which is they have a really good history of playing politics with alternative healthcare providers. But the truth of the matter is that the AMA did endorse the use of hypnosis in 1958 and continued to do so until 1987. And a year before the AMA recognized hypnosis as a viable medical modality. It was also recognized by the British Royal Society of Medicine. So it was recognized by both the Brits as well as Americans right around the same general time. And they concluded there was enough evidence for them to give it an endorsement, at least as a modality in certain particular treatments. So, okay, now moving on. It goes on to say how to find a hypnotherapist. Now, I do have a medical background, so this doesn't really apply to me so much, but it might apply to my colleagues who may not have been to any allopathic medical training whatsoever, and did mostly natural alternative training. But anyway, they go on to say, if you want to try hypnosis to help you quit smoking, ask your healthcare provider to recommend a good hypnotherapist. Here are some tips when looking for a qualified hypnotherapist. Make sure they are licensed, trained, and credentialed. Hypnosis for smoking cessation and other medical or behavioral reasons should only be done by someone who has a current license in a healthcare field such as medicine, psychiatry, psychology, or nursing. Okay, well, I'm going to just stop right there and just critique that a little bit. This just is simply ridiculous. It's bias. It is actually simply a ploy to fight for the dollars in the marketplace and to push the alternative healthcare professionals out. Hypnotherapists are every bit as professional as psychiatrists, psychologists, or even other healthcare providers. They just specialize in hypnosis. Hypnosis is their specialty. That is, they're certified in it. If they have a 300-hour or more training program, which I did, irrespective of whether they've ever had any official psychiatry or psychology training, which should have actually been included in their course anyway. But if it wasn't, I mean, that's irrelevant whether they've gone and gotten an associate's degree or a bachelor's degree in psychology or not. That's irrelevant. It depends on what they're doing. Should you be treated by a psychiatrist or psychologist versus a hypnotherapist? Well, that just depends. They're two entirely different professions. You can be a really good hypnotherapist and not be any good whatsoever or qualified in any way as a psychologist. At the same time, you could be a psychologist or a psychiatrist and be completely inept and a really crummy hypnotist. So it just depends, on what the purpose is. And many of your psychology students are only exposed to maybe 3 or 4 pages at the most of hypnosis, never really actually learning much about it beyond that. In all their training in the field of psychology. This is true. And the medical doctors, same thing. It's a specialty. And many times when the medical professional becomes certified, they go through a weekend workshop consisting of, just a few hours, just a weekend. And then after that, they get handed a certificate because they've already got big time, degrees to their name. But the reality is, that doesn't qualify them to be a good hypnotherapist. I graduated from a 300-hour program, and in addition to that, an internship. So, hypnotherapy and hypnotherapists is a profession in and of itself. It's its own profession. Again, you could be a good hypnotherapist and a crummy psychiatrist and psychologist. At the same time, flip that around, you can be a really lousy hypnotherapist, yet a really good psychologist. So it just depends on what your needs are. And to say, if it deals with smoking cessation or other medical or behavioral reasons that you should be seeking these people out, nonsense, because hypnotherapy must fall within that category. If you come to me just for self-esteem or to learn to relax, that's dealing with medicine or behavioral reasons. So that's just absolute nonsense. It's just there to get people to double think, and so that they can close the market to the alternative healthcare providers and have a monopoly. That's all that is. That's all I really wanted to really say about this. Now, this guy's credentials, he comes highly recommended. His name was Dr. Manesh Khatri, MD. He is an assistant professor of medicine at Columbia University and is board certified in nephrology and internal medicine. He received his medical degree from Duke University, completed his internal medicine residency at the University of Washington, and completed a nephrology fellowship at Columbia University. Okay, that's great. He's also had several things published and peer-reviewed journals. So, that's great. He comes highly decorated. And that's impressive. That's an impressive resume, no doubt. But again, keep in mind, that doesn't qualify him to make judgment calls in a profession of a specialty. Hypnotherapy is a specialty, and hypnotherapists are specialists in that field. Keep in mind that when it comes to being a physician or being a psychologist or even a nurse versus being a hypnotherapist, remember, all four of those are four entirely different professions. Now, sometimes they may draw upon one another and utilize one another's, little bits and pieces of one another's tools. But the reality is, hypnotherapy is its own unique profession, and it needs to start being seen that way. Anyway, I'm going to leave it at that. Just something to think about. Thank you for tuning in and taking the time and having the patience to watch this video. And I'll catch you on the next one. Thank you. Bye.